It's James Steinhubel on TVU here in Edmonton on the Health and Wellness Channel. And today we're with Dr. Jennifer Njenga, founder of Canada Home Care Group. How you doing, Jennifer?
I'm good, thank you. How are you?
Very well, very well. It's so good to have you on TVU. You have a very unique business. Maybe what's old is new again. Tell us what you're doing.
All right, so we have an after-hours clinic. It's a mobile clinic, and we're a team of doctors and nurses, and we provide non-urgent care in the comfort of one's home setting for all Albertans, really. And so that what that means is that we're able to come home if you have a non-urgent issue. For instance, you may have your blood pressure may have gone up, or you need a refill of your medication, or you have a skin infection or something like that, yourself or your child or your other loved one. So we're able to come out and provide you with that care in the comfort of your home setting. So that's what we do.
It's so interesting. So let's describe the experience for a family. So they're gonna find you, online or by a referral, and then what happens from there? How do they get a hold of you, and what will they experience?
Right, so they'll give us a call. They normally call through and say, hey, I heard about you from my neighbor, or my doctor said, you guys are out there, you're able to come home, or I can't get hold of my doctor until a week from now. Could you come home and see me? I have run out of medication, I'm diabetic, or I've got hypertension as well. I can't get to a doctor. So we say, sure. So we then schedule you for the day, might be the next day. So we work out a day that suits you because it's non-urgent. It's not urgent care, right? So we work out that day, that time, and then we come out to your house, knock on the door, you let us in, we do what we have to do, and then we leave. We may leave you with a prescription or some, requisitions for blood work. We may find that you're sort of homebound, so you have problems with your mobility. So we'll say to you, you know what, you don't have to worry to go about going to DynaLife if you can't make it. Our nurses can come out and draw the blood for you. We may also refer you to a specialist, depending what's your sort of what we've discovered for further care, or the primary care networks who we work with closely for other kind of supports. Could be dietitian, or maybe you need a physiotherapist, that kind of thing. And then away we go. If you have a family doctor, after we've seen you, we'll then request and say, we've seen you, would like to send your notes to your family doctor, because we don't do what we call rostering patients. We see you in the interim, we just prevent you from going to emergency or kind of sitting around, not having that care. So we'll say to you, give us your name of your family doctor. We'll then send them a note and say, this is what we did, we saw you, and these are the recommendations we make. And off we go. So you can call us. Our numbers are, we'll give you the numbers at the end of the interview, I suppose. You can call us by phone, or you can email us. Some people prefer to use social media. They go on and send us Facebook messages as well. Or you can fax through a requisition. Some of the doctors fax through details about their patients who they want us to follow up in the community. So it's phone, fax, email, social media.
You formed this business with a colleague. Tell us about how you formed your business.
Right. So we, the history about it is about, I guess we started the talk in 2019, at the end of 2019, and there are personal reasons and professional reasons. So I'll start with the professional reasons. There are a lot of people who, at that time, COVID was just beginning, and there are a lot of people we know in Alberta who are seniors, and others have comorbidities. And
the other thing that's of interest to me is your personal history. You were more on the public side. Right. Your initiatives, some very significant initiatives. You were more on the public side. For public, owned by the government, I guess. But now this is a private initiative. So you did that in New Zealand. Now you find yourself in Canada. Why go private enterprise when you were you've been so successful in the public field of health in the past?
Well, I guess with everything that you do over the years, you pick up a few gaps. the system is it's a large system. Healthcare is quite complex, and there are some gaps. And in my thinking and my experience, I believe that there was something else we could do, especially for people, so satisfaction for the patients, and also for the reduce that pressure on the healthcare system. We have lots of people going to hospitals. We have people who say, you know, I was sitting in the hospital in Merge for 6 hours waiting for my blood pressure to be taken, or I had to take my daughter back home after waiting for 4 hours. So we think, well, why do you have to be in the hospital for non-urgent care after hours? Of course, clinics are closed, so it's understandable, but we could come and do the home visits. We can visit you at home, and not only will we be able to see you, we might find another family member who's unwell, who also needs care. So that's where that kind of thinking came from, is that the hospitals are doing the best they can. When COVID hit, we had lots and lots of other pressures. You know, people were scared, some into the hospitals. Clinics were closing early. Their doctors were, you know, we're closing early, we weren't able to open for a long period of time. Lots of elderly people who have different comorbidities, and they said, look, we're scared of going to hospitals. There are hotspots for COVID. So the alternative was, you know, could you come home and see us? Could you do a virtual call? So yes, we do phone calls, but we can also come home and see you in the comfort of your home setting. And I think I'll expand on home setting. It's not just private home. We go to senior facilities. We work with some of the groups like HIV Edmonton, where we have some people who call that home, for instance. So where you find that you're comfortable, you call home, that's where we come.
And there's so much to talk about. You know, we could probably talk for over an hour or more about your past and exciting things that you've done. So impressive. But what's equally impressive is the team that you've put together. You've got some pretty strong players. In hockey terminology, you would say you have bench strength. Tell us about your team.
Yes, so my team, our medical director is none other than my husband. He's a family doctor and has worked as well for about 20 years as a family doctor. He came from New Zealand like me in Australia. We also have nurses who have not only a diversity in terms of skills, they're diverse in skill sets, but also culture and language, because we do realize that Canada's letting a lot of people like myself, lots of immigrants whose English is a third or fourth language. So they're the people who really struggle to access care, especially after hours. They won't know where to go. You know, they have, like, some families we visit have 9 or 10 or even 12 family members. How do you get them all into the car to go see the doctor? And lots of young children. So we find that visiting, when you go into the home, you may get a call about a dad who has, a flare-up of their blood pressure is going up, but you find mom has a problem, or there are 2 or 3 other children who have needs. And so they appreciate that we can come in the home and they can comfortably talk to us in languages which we identify with. So our team speaks a whole range of languages, from Swahili, Somali, Arabic, Hindi, Punjabi, the list goes on and on. So we're able to identify with the people we're seeing and provide them the care they need.
It's so, and the other thing, there's 2 things that I want, then I'll finish up. You're in Edmonton and Calgary. You're in both towns, Edmonton and
Yes.
Calgary. So you're growing. You're on the grow. This is a med tech, growth startup. Tell us about that.
Yes, so when we started in Edmonton, we had a few colleagues reach out to us, a family doctor and some nurse practitioners, and say, look, we want to do the same thing because we have the same issues here. We have patients who have needs, and we like the team, the fact that, you are diverse in terms of culture and language. We also speak a whole raft of languages, but we're clinical people at the same time. So we thought, you could kill so many, birds, don't kill birds, but it's one stone, where you're going in and you have the skill set, the clinical skill sets, but you also have the language and the culture to relate to the people you're seeing. So that was really key to put together a team like that. Again, goes to my background, public health. We talk about inequalities and inequity in care, where people who have, are either coming from low socioeconomic areas or are minorities in terms of ethnicity, language, and culture, really end up having poorer health outcomes. And so by, putting together a team like this, we're able to start to identify some of those issues and to address them.
And the most pertinent thing is your approach to phase 3, maybe phase 4 of COVID and the COVID vaccination program that you have on the go. This is very helpful. Tell us about that.
Yes, so we successfully did the influenza vaccine program end of last year to beginning of this year, of course. And so I reached out to Alberta Health and I said, we're not your classical, typical clinic. We don't have, brick and mortar, but we're able to do that bit. We did about 400 influenza vaccines in the community. And I requested that we join the COVID program and we're able to provide, COVID vaccines for people who, like we said, cannot access, either pharmacy or find it difficult. A lot of people say, look, my work hours cannot allow me to go get my, the vaccines, and then I have my family and 7 other family members, or I'm homebound. We've given vaccines to people who are on home oxygen, or very, very senior people in the community. So, Alberta Health said, yep, sure, go ahead and do what you're doing. Use the same model of delivery of care. And so we're doing that now.
And we could go on. I hope you come back, because we could talk about what you're doing. You are still active on the public side, and you're doing great work. So hopefully you'll come back, and we can talk more about the Canada Home Care Group, but also what you're doing with the other groups that you're involved in, if you may. It's been James Steinhubel on